Hello guys, so in today's video I'll be talking about three really important topics. The very first one is going to be the proximal and the distal dural ring. Now we all know there's a lot of confusion regarding the exact anatomy, the origin, the clinical significance of the dural rings. So I'll be talking a lot about the dural rings so that the concepts of the dural rings is really clear for you guys. The second thing which I'm going to talk about is the carotid cave. Now there's a term called as the carotid cave in the anatomy of the clinoidal segment of the ICA. So I'll be talking about the carotid cave as well. The third thing which I will be talking about is the Para-Clinoid space. Now this Para-Clinoid space is like really important for the anatomy, the neurosurgeons and the skull base surgeons. Also the clinical anatomy, the clinical significance of the carotid cave and the Para-Clinoid space I'll be talking in about details. So these three topics I'll be covering up in today's video also. But before I do that, before I do teach about the anatomy of the dural rings, the origin and the termination, the attachments of the dural rings, I really need to teach in very short brief about the anatomy of the clinoidal processes. So if I just turn over to this another 3D model over here. This is a 3D model of the cranial vault, which as you can see on the screen right here, you can actually see a superior view of the cranial vault, and we can see all the three cranial fossas. That's the anterior, middle and the posterior cranial fossa. So as you can see over here, the sphenoid bone is completely labeled as yellow, and if I can just zoom this for you guys, you can see that's the lesser ring of sphenoid, that's the greater ring of sphenoid. Now the three clinoid processes are really important to understand. Now that's the hypophyseal fossa, that's the sella turcica in which the pituitary gland is lodged, and that's the clinoid process. That's the anterior clinoid process over here. It has a posterior medial projection, as you can see over here, that is projecting posteriorly and medially. That's the anterior clinoid process. Now exactly over here, the projection which you can see over here in the area of the hypophyseal fossa anterior aspect, this is the middle clinoid process. That's the middle clinoid process. And if I can show you like this over here, this is a clivus region, that's the clival bone, and at the very superior edge you can see the posterior clinoid processes. So these are the three clinoid processes which are really important. And this over here, if I can show you, that's the petrous apex over here. So that somewhere around here is the petroclival ligament. So that's the Gruber's ligament somewhere over here, which I'll show you in some future videos in detail. When I talk about the anatomical course of the abducens nerve, I'll show you the Gruber's ligament as well. The petroclival or the petrosphenoidal ligament, that's the other name for it. So the Gruber's ligament is also having a really important role in the term Para-Clinoid space, because when I'll teach you about the Para-Clinoid space, we need to know the anatomy of the Gruber's ligament as well. That's the petroclival, the petrosphenoidal ligament as well. So moving further, this was the anatomy of the clinoid processes. Okay, that's it. So when I start about the dural rings, before that, one more thing I have to make sure is the anatomy of the clinoidal ICA. Now in my previous lecture, I spoke about all the different anatomical parts of the ICA. The previous one was just the cavernous one, the cavernous ICA. Today I'll be talking about the clinoidal ICA. So the clinoidal ICA is a part of the internal carotid artery which exactly lies at the level which originates from the proximal dural ring and terminates in the distal dural ring. So if I can show you one more photograph, a diagrammatic representation, if I can just zoom this for you guys. Now this is a left side of the patient, this is a front view, that's the midline, that's the pituitary gland over here, the optic chiasm. So when a skull base surgeon along with a neurosurgeon operates on a patient endoscopically, endonasally, when it enters the sphenoid sinus, we can see the carotid bulge on the lateral wall of sphenoid along with the optic nerve bulge superior laterally. Something we can see in between is the pit-like depression over here. That is nothing but the pneumatization of the optic strut. That is a part of the anterior clinoid process. That is called as the lateral optico-carotid recess. Now there's a structure called as the optic strut, which is nothing but a bony part of the anterior clinoid process, which undergoes a lot of pneumatization, and that is called as the lateral OCR. That's the optico-carotid recess. That is the area between the carotid artery and the optic nerve. Okay, that's the optic nerve over here. So as you can see on the screen right here, this is the proximal dural ring, and that's the distal dural ring. Now this short segment is having no branches, just like the cervical segment. This the clinoidal ICA does not have any branches, and above that you can see the cisternal part of the ICA, that's the ophthalmic branch, and that's the superior hypophyseal arterial branch. So this is the part we need to understand the proximal and the distal dural ring as well. So to understand that, we just spoke about the anterior clinoid process, the lateral OCR, and the optic strut as well. So this was about the basic anatomy. Now I should start with the anatomy of the proximal dural ring first. Now the proximal dural ring is the one which you can see at the lower level, which is kind of posterior in aspect. The other name for the proximal dural ring is also called as the Perneksky's dural ring. It is also called as the Perneksky's dural ring. That's the other synonym for that. The distal dural ring is kind of at a superior level. That's why it's called distal, and it is actually above the proximal dural ring. So these two dural rings are nothing but the medial prolongation or continuation of the dura mater. These are dural rings, okay, which cover the area of the carotid artery right here. Now the roof. Now as you can see over here, this is the proximal dural ring. The proximal dural ring is nothing but the dura which is at the roof of the cavernous sinus. Now the roof of the cavernous sinus is divided into both anterior and posterior. The anterior dural sheath is actually between the cavernous sinus and the oculomotor nerve. So that dura, it actually prolongs medially and forms the proximal dural ring. Similarly, the distal dural ring is actually present as a medial prolongation of the dura mater, which is actually a continuation of the falciform ligament, which you can see lying above the optic nerve. So this is a basic anatomy. That is, it is nothing but a dural prolongation medially, and the proximal one is actually the basic dura which covers the roof of the cavernous sinus, and the distal one is basically the one which is continuation of the falciform ligament, which I've spoken about in my previous video of the transcribriform and the tubercular approach. Okay, so that is the falciform ligament continuation, and in between the two we can actually see the clinoidal ICA. So wherever the anterior clinoid process lies, the clinoidal ICA lies at the same level right there. So one more point I need to tell you on that is the proximal and the distal dural ring are not in continuation on the anterior aspect, but if I can show you on a different photograph right here, as you can see over here, this photograph, if you look carefully, now this is the patient's right side. This is a posterior view. This is like a view from behind. So you can see the optic chiasm over here, the optic nerve, that's the ICA, that's the clinoid process, that's the anterior clinoid process right here, and that's the cavernous sinus, and that's the lateral wall of the cavernous sinus. So if you look very carefully, this is a posterior aspect, this is a distal ring, that's the proximal ring right here. Now, as I said some time back, the proximal ring is nothing but the dura, which is a continuation and forms the roof of the cavernous sinus. Now, the cavernous sinus roof is nothing but the dura mater covering it above. That is the proximal ring, and the distal ring is something which is a continuation of the falciform ligament. So between the two, there is ample amount of space, no connection at all anteriorly, but if you can see it posteriorly, you can see that there is a connection between the two. They are fused posterior medially, and that is the area where the distal and the proximal ring are connected to each other. that is really important to understand. So that is the basic anatomy. So if I can show you one more photograph over here, I can show you optic strut on this photograph. So as I was talking about the optic strut, the structure which you can see right here, which is adjacent and lateral to the middle clinoid process, is the optic strut. You can follow the optic strut. This is the area of the optic strut. That's the area of the optic canal. That's the anterior clinoid. That's the middle clinoid, and that's the posterior clinoid, as I was showing you on the 3D anatomy model. So to make your concepts about the proximal and the distal dural ring really more clear, I'll show you this photograph. So as you can see over here, this is the lateral aspect of the same structure which we just read some time back. This is the lateral aspect of it. So as you can see over here, that is the proximal dural ring, which is at a lower level, and that's the distal dural ring, which is at a superior level. And the third cranial nerve, the fourth and the fifth one, that's the first division of trigeminal, is actually running inferiorly and anteriorly to the proximal dural ring and enters into the superior orbital fissure. So whenever a neurosurgeon or a skull-base surgeon is operating endoscopically, they should really know the difference that whatever structure, that's the third cranial nerve, the fourth cranial nerve, and the fifth, that's the V1, will always be below the proximal dural ring, and the proximal dural ring will be above the level of these three structures. So this is like really important to understand. And as you can see, if I show you this different structure, so also there's one more concept about the medial wall and the lateral wall of the dural rings. Now the dural rings on the lateral aspect of the ICA. Now if you can see over here, this is the medial aspect, that's the lateral aspect. Now on the lateral aspect, the dural rings, the proximal and the distal dural rings, are strong enough. They are attached to the carotid sulcus. Now the carotid sulcus is fixing the carotid artery in place with the attachments with the help of the clino-carotid ligament. That's the carotid-clinoidal ligament. This ligament is nothing but the formed from the dura, which is lying between the anterior and the middle clinoid process. So we sometime back saw the anterior and the middle clinoid process. So in between those two, we're going to find the carotid-clinoidal ligament, which will keep the artery intact, attached to the carotid sulcus in the sphenoid bone medially as well. So always remember that the medial aspect, the inferior, that's the proximal dural ring, is actually having a small opening. It's not a complete ring. Medially, it is having a small opening, and through which all the venous channels from the cavernous sinus will travel superiorly upwards towards the area of the superior, that's the distal dural ring. So that's one thing about the inferior, or you can say the proximal dural ring. Similarly, the distal dural ring will also have a weakness, or you can say an area of opening posterior medially. That's the area of the weakness called as the carotid cave. So that's the term called as the carotid cave. If I can show you on a different photograph right here, as I was showing you some time back, this was the area where the distal and the proximal dural rings are fused together, but this was a medial aspect. Now medially, superiorly, the distal dural ring shows an area of weakness that is called as the depression, called as the carotid cave. This carotid cave will have a clinical significance because the aneurysm from the internal carotid artery will be common in this area. So if I can show you on one more image right here, which is clearly showing the area of the carotid cave. As you can see over here, this was the anterior clinoid process, that's the lateral aspect, and this one was the sphenoid area. This is a medial aspect. So this is a posterior surface where you can see the distal and the proximal dural rings coming in contact with each other, but the anterior surface is not. And posterior medially, superiorly, you can see that the distal dural ring is kind of deficient in relation to the attachments over here, and this will create an area of deficiency or a lag, which is called as the carotid cave. this area is of real significance because a lot of patients will have the ICA, the carotid aneurysms in this area. So if the aneurysms keep on growing, it will result eventually in spread either inferiorly or superiorly. So as you can see over here, this is the aneurysm, which is kind of small in origin, but this is the aneurysm which is present in the carotid cave. And if the aneurysm is not resisted by the attachments or the ligaments over here on the medial surface, it can eventually go inferiorly and enter the cavernous sinus, and in that time it may have a bleed, and it may cause a cavernous bleed, a cavernous hematoma as well, and also compression of all the structures in the cavernous sinus, and may result in an emergency. Also, there's one more important point to remember. On the medial aspect, superiorly, the distal dural ring is very not close enough to the ICA. So if I can show you the previous one, so as you can see over here, the distal dural ring is not in very much close relation to the medial aspect of the ICA. So it is also covered, some part of the ICA is also covered up with the arachnoid layer as well. So this region of the ICA will also be covered with some area of dura mater and some area of the arachnoid as well. So if there is an aneurysm in this region and the aneurysm bursts open, it may sometimes have a subarachnoid hemorrhage as well. So that's the first clinical anatomy, clinical significance of the carotid cave. The second clinical significance of the carotid cave over here is that the superior hypophyseal artery may sometimes have an origin from this area, as I showed you some time back on this image right here. It's right here somewhere. Yep. So as I was showing you the area of the medial aspect, posterior superiorly, the area of deficiency where the carotid cave occurs. So sometimes the superior hypophyseal artery may have an origin from that region. So this is the anatomy, the clinical significance of the carotid cave. Now the next thing which I was going to talk about is the paraclinoidal space. Now before that, I'll show you a cadaveric photograph of the of patient. Now I've turned this less reddish because I don't want to show all bloody field out here. So this is a cadaveric photograph of the area of the sphenoid and the suprasellar approach as well. So if I can just zoom this for you guys, you can see that's the pituitary gland in the midline, that's the clival bone inferiorly in the midline, that's the optic chiasm, that's the anterior cerebral artery, that's the suprasellar approach to third ventricle. You can clearly see the area of the proximal dural ring right here. This is a dural fold actually. That's a complete dural fold you can see over here, and that's the distal dural ring, which is the complete dural fold which you can see over here. That's the optic nerve, that's the ophthalmic artery, that's the carotid artery over here which you can see. So this is the area of the clinoidal internal carotid artery which you can see over here right there. So this is nothing but a fold of the dura mater, the inferior one being the floor, the roof of the cavernous sinus, the superior one being a continuation of the falciform ligament which is somewhere here. This is the area of the dura and the falciform ligament which is overlying the optic nerve right here. So we know where the superior, that's the distal dural ring comes from, and we know now where the inferior, that's the proximal dural ring comes from. So the last thing which is left is the paraclinoidal space, right? Now the paraclinoidal space is something which is on the lateral aspect of the carotid artery in the paraclinoidal segment. So if I can just show you this area, this one, okay, I'll show you this one only. So we know that this is a medial aspect, this is the left side of the patient, that's the medial, and that's the lateral aspect. Now the paraclinoidal space is bounded by three structures. Now if you can just imagine that this is the lateral aspect, now superiorly, inferiorly, and laterally it is bounded by three structures. Now So as you can see on the screen right here, that's the lateral aspect where the petroclinoidal, you can see the paraclinoidal space lies. That's the anterior clinoid process. Now the three boundaries, the lateral boundary is the petroclinoidal the ligament. Now the petroclinoidal ligament extends from the anterior to the posterior clinoid process and the petrous part of temporal bone. These are nothing but the dural folds that spread between these three structures, and that becomes the lateral boundary of the paraclinoidal space. The superior boundary will be the area of the ventral surface of the cisternal segment of the ICA, and inferiorly will be the dura of the roof of the cavernous sinus. So this entire structure will be the lateral paraclinoidal space. Now, clinical significance of this paraclinoidal space is the same as that of the carotid space, is the aneurysms. Now, the aneurysms are more common on the medial aspect, as we saw some time back over here. This is more common on the medial aspect rather than the lateral aspect, because on the lateral aspect we can see the petroclinoidal ligament, which has a good amount of resistance on the lateral aspect. So the aneurysms on the lateral aspect in the paraclinoidal space are much rare and do not spread exponentially, and this is the clinical significance of that space as well. So also the aneurysms in the paraclinoidal space are actually divided into two things. One is called as the suprasellar, and the other one is called as the paraclinoidal. So paraclinoidal, which is actually superior laterally, and the second one, which is the suprasellar, which has got a superior extension from the lateral aspect. So it will extend way high up along the cisternal parts of the ICA. So this is the clinical significance of the aneurysms of the two spaces, the carotid triangle and the paraclinoid space as well. So I hope the concept of the inferior, that's the proximal, and the distal dural ring is very much clear for you guys. And if you have any doubts regarding this, you can please comment me on my description panel, the comment section below, and I'll try to solve them for sure. So I hope you like the video. Leave a like behind, and if you want more videos like this, subscribe to my channel, and till then, take care guys.